Good evening. This is Leah Olmstead. I'm here to talk about the literature review and presentation for Holistics 4850. My topic is the United States Army, and it is currently using complementary and alternative medicine, or CAM as I will refer to it through the duration of the presentation, and how its approaches are minimal and supplemental capacities to treat mental health disorders specifically. And CAM, as most of us know, is a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be a part of the conventional medicine. Some key ideas that I will highlight throughout the presentation are current U.S. Army health systems and practices, holistic and CAM practices and procedures, and the integration of holistic practices into the military health care system. A little bit of history and background. I've highlighted four things. One, extensive history of holistic practices, and I think all of us kind of understand that being in this course, but as some course material has told us, dating back to the first civilizations, we can see holism kind of have its starts and be used alongside traditional medicine. And the second one, there's limited knowledge of endorsed use of holistic medicine in military, so I had to kind of do a little bit digging. I did find in the Civil War, Union doctors use antimicrobial properties in 3 plants, and that dates back to 1863, which I thought was really interesting. The third one, military health systems, or MHS, integrate holistic practices in patient care. So one statistic I found was 110 out of 133 military treatment facilities, or MTFs, use holistic practices already. And the first official use of holistic healthcare in Army doctrine was pretty recent, actually, and it was initiated in October 2020. And through this, we can see the in-depth detail of current holistic health and wellness practices and policies that the Army already has in place. Starting out with research, our research question for me primarily is, what extent does the U.S. Army use CAM or other holistic practices in their healthcare system? And to follow up with that, is the current use of holism in the U.S. Army effective? And what do we know about the CAM and other holistic practices in the military? Again, my thesis statement is the United States Army is currently using CAM in a minimal and supplemental capacity to treat mental health disorders for its members and veterans. And I think the implementation in its basic form is the United States Army should increase the amount of CAM and holistic practices used in treating military members, beneficiaries, and veterans. Kind of first and foremost, the first thing I want to cite here is the current military doctrine that's in place. This is known as the Holistic Health and Fitness, or H2F, specifically the F-22 doctrine. And in Section 4 of this document, that's hundreds of pages long, it talks about physical readiness, nutritional readiness, mental readiness, spiritual readiness, and sleep readiness. And this is what they outline as holistic health and fitness. This is the only doctrine that currently exists in all armed services, which includes Navy, Air Force, Marines, Coast Guard, and Space Force as well. And again, like I mentioned earlier, this was published in 2020. This is the first document and doctrine that we see including holistic health. Next, another research thing that I found was complementary and alternative medicine services in the military health system. So this comes from a 2017 research study, and it collects data from 133 military treatment facilities. Again, out of 133 military treatment facilities, 110 use holistic practice in their treatment. 74, which is the bulk of those military treatment facilities, offer anywhere from 2 to 8 different types of CAM. And the CAM-related programs can include stress management, relaxation therapy, animal-assisted therapy, herbal medicines, traditional Chinese medicines, and many more. It was interesting to see that CAM practices are being used to treat chronic pain, anxiety disorders, stress management, sleep disturbances, and depression. Another research article that I found, effects of mindfulness training on resilience and leadership in military leaders, so specifically kind of looking at that resiliency, mindfulness, and leadership piece. So this was a 2020 research study conducted with the Air Force members specifically, and pretty much the results were participants that had experiences or had this training with mindfulness stated that it had a positive effect on their leadership behaviors, their resilience, and their perceived effectiveness with their other members. However, this is where I first began to realize there were some limitations to military research in and of itself because of some redacted information and redacted data that I could not access. Another research study I was able to use was the use of integrated medicine in the military and the United States military health systems. Again, this is kind of survey research. In 2017, the military health system treats about 9.4 million military members, their beneficiaries, and retirees or veterans. And within this article, they talked about the polytrauma triad, and this is what many military members come in primarily to seek treatment for. And this includes their chronic pain, traumatic brain injuries or TBIs, and then the PTSD, which is post-traumatic stress disorder. And the mental health or military health system includes 55 major hospitals across the country, across the world, and 373 military medical clinics, which are kind of outposts of those major hospitals. And of those, the complete military numbers that we have, there are 275 military systems that use CAM or holistic related practices. So not all of them, but a big majority is moving that way. Another research that I found kind of had to do with equine assisted therapies and programs with specifically PTSD or traumatic brain injury. So this was a 2020 research study. This included work with veterans and their family members specifically. So 106 people, veterans, and their families participated in an intensive outpatient program, or IOP, and the results of working with equine animals, horses, resulted in the following: emotional rehabilitation, effective immersion in activities, fostered growth with interpersonal relationships, and provided education for family members and service members or veterans for PTSD. So in conclusion, with the research that I had just highlighted, within military health systems and military treatment facilities, there are CAM and holistic related therapies that are being used and being provided. The majority of military health facilities and military treatment facilities started using CAM and holistic related practices to better healing for their patients. So nowhere did I find that the military itself or the Army itself said, hey, let's start using these practices because they're good. This was individual providers, individual doctors that started using these practices, holistic practices for their patients. The U.S. Army has started to officially embrace its CAM and holistic health benefits by introducing that doctrine in 2020. There are limited research studies and projects studying holism in the military, however, and I think that's definitely something that needs to be included moving forward. Some information, again, like I said, had to be redacted due to the sensitive nature of the information. Overall, the military is slowly integrating its healthcare system to include holistic practices. Some implications moving forward. These findings we can use day to day with interactions with patients, using that holistic view or lens to treat patients. We can understand the effectiveness of CAM and holistic treatments for military populations. We can increase using CAM and holistic treatments in any healing practices inside the military. And we can advocate for CAM and holistic practices within military populations. Also, I think we can increase funding for holistic health research in military populations specifically. Overall, this is my citations